Hello everyone, welcome back to my channel. Today this video is related to top 50 respiratory MCQs for doctor practice test 2. If you didn't watch the previous video which was related to cardiology MCQs, so I would strongly recommend to you to watch that video also. I will give you the link in the description so you can easily click on the link and watch the previous video. If you didn't subscribe to my channel, so I would strongly request to you and recommend you to please like and subscribe my YouTube channel so you will get the notification once we upload the next video which will be related to the gastroenterology and hepatology MCQs. Let's move to the top 50 respiratory MCQs. And the first question in this video, what I will do, I will read the question. You can read the four option and pause the video for 5 seconds. Select your best option and compare that option with the correct answer which I will provide to you. Let's move to question number 1. A patient present with wheezing, shortness of breath, and chest tightness that worsen at night. Which diagnosis is most likely? Pause the video for 4 seconds and do your selection, please. In this scenario, the correct option will be option B, bronchial asthma. You can also read the rationale if you want to get more knowledge related to the question. Let's move to the next question, which is question number 2. A patient with a 30-year history of smoking present with a chronic cough and sputum production. What is the most likely diagnosis? In this scenario, the correct option will be option B, COPD. Let's move to the next question. Question number 3. Sudden onset of pleuritic chest pain in breathlessness in a post-operative patient most likely indicate which condition? The scenario, the correct option is option B, pulmonary embolism. Let's move to the next question. Question number 4. The hallmark symptoms of emphysema is, read the option. In this scenario, the correct option is option B, shortness of breath on exertion. Let's move to question number 5. Which of the following condition is most likely to cause massive pleural effusion? Pleural effusion. The correct option is option B, lung cancer. Let's move to the next question. Which type of symptom is commonly seen in bronchial asthma? The correct option is option B, mucoid. Move to the next question. This question number 7. Which of the following is reversible airway disease? Read the option. In this scenario, the correct option is option C, asthma. Let's move to the next question. In COPD, oxygen therapy should aim to maintain oxygen saturation at, read the 4 option. The correct option is option C, which is 88 to 92%. Let's move to question number 9. Which of the following findings suggest a malignant lung cancer mass rather a benign one? The scenario, the correct option is option C, rapid growth. Let's move to the next question. A patient present with dullness on percussion, decreased breath, sound, and tracheal deviation to the opposite side. What is the diagnosis? In this scenario, the correct option is option B, pleural effusion. I would love to hear from each of you about all these 10 questions, whatever the whatever the marks you obtained, whatever the number of questions you corrected, please share in the inbox so I can see. Okay, and also if you didn't subscribe and like our channel, so please like and subscribe so you will get the notification once we upload the next video. Let's move to the next question, question number 11. Bring this question down to the next page. Question number 11 is, which of the following is the first line treatment for an acute asthma attack? Pause and think which one fits best and then reveal answer below. The situation, the correct answer is option B. Let's move to the next question. Which of the following is a typical feature of chronic bronchitis? Read the 4 options. Then I will give you the correct answer. In this scenario, the correct answer is option A, productive cough for at least 3 months in 2 consecutive years. Move to the next question. The next question is, come a little bit more down. Which of the following is most likely to cause a transudative pleural effusion? In this scenario, the correct option is option A, congestive heart failure. Move to the next question. Which of the following is a major risk factor for pulmonary embolism? Pause and think which one is the best option. Option A, a long haul flight. Let's move to the next question. A patient has a 2 centimeter solitary pulmonary nodule on chest X-ray. Which features suggest malignancy? Read the 4 options, pause the video, and think for the best option. And here in this scenario, the best option is option B, speculated ages. Let's move to the next question. Question number 16. Which of the following is a common trigger of asthma exacerbation? The correct option in this situation is all of the above. Move to the next question. Question number 17. Which pulmonary function test finding is characteristics of COPD? In the scenario, the correct option is option A. Let's move to the next question. The next question is, I'll bring this question down again. You can see clearly on the next page. Next question is, a patient present with pleuritic chest pain and dyspnea on exam, breath sounds are decreased and percussion is dull. What is the most likely diagnosis? Option B, pleural effusion. Let's move to the next question. Which of the following is considered a late sign of pulmonary embolism? The correct option is option C, hypotension in shock. Let's move to the next question. Which of the following is a common complication of long-standing COPD? Read the option. In this scenario, the correct option is option D, all of the above. Let's move to the next question. Question number 21. Which of the following symptom is most suggestive of lung cancer? The correct option is option A, a resistant cough with hemoptysis. Let's move to the next question. Which of the following is an early feature of asthma? In this scenario, the correct option is option A, nocturnal symptom. Let's move to the next question. Question number 23. Which of the following is considered as a risk factor for COPD? Correct option is option D, all of the above. Let's move to the next question. Question is a patient with a sudden dyspnea, pleuritic chest pain, and hemoptysis most likely has. The correct option in this scenario is option B, pulmonary embolism. Let's move to the next question. Which of the following pleural effusion is usually exudative? The correct option is option C, pneumonia. Let's move to the next question. Which of the following is a typical sign of chronic bronchitis? And the correct option is option B, productive cough. Let's move to the next question. Question number 27. Which of the following is most common presenting symptoms of pulmonary embolism? In this scenario, the correct option is option D, night sweats. Let's move to the next question. Question number 28. Which of the following is the hallmark of restrictive lung disease? The correct answer is option B, reduced total lung capacity. Let's move to the next question. Question number 29. Which of the following pending is a common in emphysema? The correct option is option A, hypersonic percussion. Then let's move to the next question. Question number 30. Which of the following is a common complication of untreated massive pleural effusion? The correct option is option B, mediastinal shift. Let's move to the next question. Until now, I would love everyone can share the score, like how many answers you corrected out of 30. If you are scoring between 25 to 30, so I would say you are on the right track. In this way, you will be able to pass your upcoming Prometric in-person view exam. So make sure to share your score in the comment section. If you have any query and concerns, you can also send me a message. And if you didn't subscribe our channel, please like and subscribe so you will get the notification once we upload the next video. Let's move to the next question. Question number 31. Which of the following is the first line imaging for suspected lung cancer? The correct option is option A, lung chest X-ray. Let's move to the next question. Which of the following is a feature of severe asthma attack? The situation, the correct answer is option B, respiratory rate more than 30 minutes per minute. Let's move to the next question. Which of the following medication is used for long-term control of asthma? The correct option is option B, inhaled corticosteroids. Question number 34. Which of the following is a common symptom of pleural effusion? Correct option is option B, dyspnea. Let's move to the next question. Question number 35. Which of the following is a classic triad of pulmonary embolism? The correct option is, in this scenario, the correct option is option B, dyspnea, pleuritic chest pain, and hemoptysis. Question number 36. Which of the following pulmonary function test result is typically in asthma? The correct option is option A, obstructive pattern with reversibility. Move to the next question. Question number 37. Which of the following is the classic sign of advanced emphysema? In this scenario, the correct option is option A, barrel chest. Let's move to the next question. Question number 38. Which of the following is the most common cause of secondary spontaneous pneumothorax in adult? The correct option is COPD and / emphysema, option B. Let's move to the next question. Which of the following is the most common cause of exudative pleural effusion? The correct option is option B, pneumonia. Let's move to the next question. Question number 40. Which of the following is the main treatment for massive pulmonary embolism? The correct answer in this scenario is option C, thrombolysis. Let's move to the next question. Which of the following is the primary mechanism of airflow limitation in COPD? Read all four options, think, and then I will go to give you the correct option. In this scenario, the correct option is option A, airway inflammation and alveolar dysfunction. Question number 42. Which of the following clinical features suggest a malignant lung mass? The correct option is option D, all of the above: weight loss, hemoptysis, and recurrent infection. Let's move to question number 43. A patient present with a sudden short of breath, pleuritic chest pain, and unilateral leg swelling. What is the most likely diagnosis? In this situation, the correct answer is pulmonary embolism. Question number 44. Which of the following auscultatory finding is characteristics of asthma? The correct option is option B, wheezing. Question number 45. Which of the following is the gold standard for diagnosing pulmonary embolism? And this is CT pulmonary angiography, option C. Question number 46. Which of the following is a common signs of pleural effusion on physical examination? The correct option is option B, dull percussion note. The next question is, which of the following is a common long-term complication of untreated COPD? Bring this question onto the next page so you people can easily see. In this, the correct option is option D, all of the above. Question number 48. Which of the following imaging finding is most suggestive of lung mass? The correct option in this scenario, read this question carefully and decide which one is the correct answer. The correct answer is option A, solitary nodule with speculated margin. Question number 49. We will also bring this question down to the next page so you can easily see this one. Which of the following intervention is first line for severe asthma exacerbation? The first line treatment option for asthma is option B, inhaled short-acting beta agonist. Let's move to the last and final question of this vlog, which is a patient presents with a sudden dyspnea, chest pain, and hypotension. Which of the following is the most urgent next step? Read the four options, select your best option, and then compare it to the answer which I am going to give you. In this scenario, the correct option is option B, initiate anticoagulation or thrombolysis. So this was the end of this vlog. Thank you so much for watching this vlog, and I would say if you didn't subscribe our channel, so please like and subscribe our YouTube channel so you can get the notification once we upload the next practice test, which will be related to gastroenterology and hepatology. I would also request you to watch the previous video of practice 2, which was related to cardiology MCQs. And if you don't have a link, I will give you the link in the description so you can go and watch that video also. Thank you so much and have a nice day.